I have patients coming to me, they've had dentures for many years. That's just one example of treatments. And they've been sort of living with the dentures, sort of coping with them. And they want to look for something better, something that they can enjoy their food a bit more comfortably. So they'll look at maybe implants. So that's that transition from NHS to private dentistry. And with implants, it opens a whole range of different possibilities for our patients to be able to eat comfortably, to be able to taste their food again. All of these things, just again, it's all about bringing the patients their confidence back, their smile back, and that's what I love about private dentistry, really. So I mean, there's many benefits of our patients getting implants. To mention a few, they can taste better when you have dental implants. You get that texture of your food a bit better. There's more confidence because you're not worried about teeth moving. You can clean a little bit better with your implants, and also it maintains the bone as well. So you kind of maintain that structure of your face a lot better with implants as well. So many benefits to having implants. As we've all heard before, implants are the gold standard for replacing missing teeth. Why is that? Okay, so we've got a couple of different options. We've got dentures, of course. Everyone's seen those dentures. Everyone's seen those images of dentures sort of falling out when you're laughing, you know, those kind of things. You have bridges. Why are implants better? Well, implants are the gold standard because it's a fixed option. It allows us to maintain the bone that we've got. It allows us to give the patients their confidence back. So many things. So, you know, I can think of an example today where a patient came in, we were reviewing once we placed some implants, and she was just telling me how much she finally enjoyed to eat her steak. You know, that's we hear it all the time, you know. We take it for granted, some of us, you know, eating a steak, but having teeth back that you're not worried about, you know, something falling out, you can taste it, you can enjoy that texture, and it really does. Implants do feel like you've got your teeth back. So that was one thing. It can sound quite daunting when you think about it, especially if you dive into it, you know, implants. And a lot of my patients are a little bit anxious just about what it involves because they're not really quite sure. So we do our best here to explain patients every single step. What I would say is a common misconception is that you need to be at hospital. There's a lot of downtime that you need after having an implant done. There's a lot of swelling or all these kind of things. That's not necessarily the case. So I would encourage you to chat to us. Every case is slightly different, but for a lot of our patients, we just do local anesthetic, make sure they're not feeling anything. They might be in and out within an hour, and they've got an implant, and a lot of my patients go to work the very next day, even though I might tell them not to.